168 out of 254 counties do not have a licensed psychiatrist, 78 counties without chemical dependency counselors. There are more examples that we all know. Senate Bill 646 aims to address our mental health workforce shortage by bringing professionals to areas experiencing a service gap like many of our rural communities. And especially after Uvalde, we wanted to make sure that we have school counselors available.
The goal of your bill is laudable. More services for needy people it's a great thing, but I worry about the unintended consequences. Does your bill do anything to protect children from the dangers of social transitioning?
This is about school counselors. There are different sets of rules that manage what school counselors are doing with our students.
What you're doing here is you're advancing the number of people that are advancing this.
Again, right now the law does say that we need to have school counselors available for our public schools. This just makes sure that they have a loan repayment program.
Why are we advancing more counselors in our schools that are members of these associations that are encouraging kids to seek gender-affirming care?
Again, school counselors, their main objective is not about gender-affirming care. It's making sure that students have the tools they need to be successful. School counselors do a multitude of things for our students, including making sure they're taking the right courses to set themselves up for success.
Did you know that only 12% to 27% of children who experience gender dysphoria carried into adulthood?
Again, that has nothing to do with this bill.
What about suicides, Ms. Davis? Are you aware that individuals who receive this kind of experience as kids have a higher suicidal rate?
Again, that has absolutely nothing to do with this bill.
Would you
Please
be open?
confine your remarks to the subject of the bill.
You're right. Would you be open to accepting a friendly amendment to protect our kids from these adverse health outcomes?
Again, that is not germane to this bill.
My amendment would prohibit professionals engaged in social transitioning from being eligible for loan repayments under this program. Would you accept that as an amendment?
Unfortunately, that is not a part of this bill.
Please confine your remarks to the subject of the bill.
What this comes down to is, why are we spending tax dollars to affirm this kind of counseling if these counselors will not make a commitment to not take part in this?
You realize none of that has anything to do with this bill, right?
It absolutely
None of it.
does. It absolutely does.
Mr. Toad, do you know what this bill is about?
This bill is about forgiveness of student loans.
It is student loans for mental health professionals in our public schools.
Correct.
That has nothing to do with everything you were just talking about. Do
Sure
you realize
it does.
that?
You're taking money from taxpayers and you're forgiving the student loans of people that are engaged in this kind of activity, and we should make sure that we don't do that.
And you think students shouldn't have the ability to talk to a professional in a school setting when suicide is the second leading cause of death for young Texans?
I do, and they should actually be encouraged to talk to their parents as well.
Well, sure they should. There's nothing in this
bill
bill
that... But they're not being encouraged to talk to their parents as well when they're experiencing gender dysphoria.
Mr. Toth, can you point to anything in this bill that discourages students from talking to their parents about anything? Is there anything in this bill that does that?
We should be encouraging before we acquiesce and give people...
So the answer is no. This bill is simply trying to incentivize mental health professionals to take these counseling jobs in our schools where we have a severe shortage